So my name is Dr. Sheena Walker. I'm an assistant professor here of psychology in the Department of Psychology. And not only that, I'm also a licensed clinical psychologist who is in practice. So what I'm going to be sharing today is information that is very near and dear to my heart, but also something that's also pretty familiar. So if you have any questions, I welcome you to just ask, shoot right from the hip, and then maybe we can hopefully get a conversation going if need be, so that I can answer those questions. So to get a start, what do we already know about depression is that there is a significant relationship among depression and college students. And in fact, we know that it's becoming increasingly more and more prevalent in our college students, and it has been said for being one of the major barriers for doing well in school. In fact, more specifically, 16% of our college students reported that depression had a negative impact on their academic performance. And this information was taken in 2017. So imagine, outside of the context of the pandemic and outside of the context of this new national election and the economy, depression and anxiety really had a large impact on college students already as we know it. So with depression and anxiety affecting more and more of our young adults, it's really important that we have this conversation, that we continue to have workshops such as this, so that we can just increase awareness about the experience of depression as well as anxiety, so that we could help folks to get a bit more healing. So more recently, a study was done by the Strata College Pulse Survey here, and this was again done this year, asking college students again about their biggest challenge or struggles in continuing their education, particularly this fall. And the one thing that you'll see, and I'm sure many of you could probably relate to, is that stress and anxiety along with loneliness is a major struggle for almost half of the respondents that were participating in this study. 21% said that keeping up academically was a struggle. Many of you have now abruptly shifted to learning virtually. I was saying earlier this morning, we at UVI honestly have had an advantage given the fact how much we use our technology and our innovation and things of that nature. So we were a little bit ahead of the curve as it related to shifting into this virtual learning. However, what is not normal, right, is the amounts of which we are isolated, the amounts of which we're not really able to support one another. And so it really has played a major part in challenges of a lot of the students that were surveyed here, and I'm sure as it relates to your experience as well. Another thing that students indicated as an issue was having a space for studying or participating in classes. So a lot of us are doing things at home, working from home, trying to rest from home, socializing from home. We're doing all of these things from home. Therefore, it becomes very, very blurry and the boundaries sort of get muddied. And just human nature, we really respond well to organization, to structure, to boundaries. And so this oftentimes contributes to the experience of depression and of anxiety. And a lesser of the extent of the population here that was sampled said 3% of the population, said that they're taking care of people who depend on them while they're in school. So maybe it's an elderly parent, maybe it's a child. What I can say for us at UVI, I know many of our students are also parents or are caring for other family members. We have a very tight-knit community. So this is something else that we ought to be aware of. And if you are in this situation, just be mindful and a little of your reaction to your stress and how you're managing your daily activities. So now, taking into account the new coronavirus and the standards that have come along with that, it really has led into a number of mental health challenges. So I wanted to highlight a study that was done by the Centers for Disease Control that recently was able to assess folks from the months of April to June. So early into the pandemic, going into sort of the mid-season, if you will, of our pandemic year this year. And what the study found is that symptoms of anxiety disorder and depressive disorder increased considerably compared to that of the same sample taken in 2019. And in fact, almost half of the respondents reported at least one adverse mental and or behavioral health condition that includes anxiety and depression or trauma related to the pandemic. So I want to talk about the grief experience just very briefly, because I categorize that, as well as the study, as a trauma experience. So many of us may have lost family members or friends, and hadn't had the opportunity really to congregate with our friends and family to send off our goodbyes, right? And for many people, not being able to sort of participate in that process of grief really does create a very traumatic injury that can definitely play into a number of other mental health challenges. So again, we want to be very mindful if this is how you're experiencing life during the pandemic. Just be mindful and careful of how it is that you're responding to take care of yourself. Another result coming from this study showed that 13.3% of the respondents disclosed of having started or increased their substance use to cope with the stress and or emotions related to COVID-19. And this really and truly is not a very difficult tendency to fall into, especially here in the Virgin Islands. Alcohol is cheaper than water and maybe even more available, right? And so I think it's very easy for us to try to drown ourselves in alcohol to avoid experiencing any complications related to stress. So we need to also be mindful of that as well. Another thing that was extremely staggering to hear from this study, however, also not surprising for me as a clinician, is that 10% of the respondents who reported seriously considered suicide in the 30 days prior to completing this survey, which is extremely significantly higher from the previous year as well. And again, the thing for us to really be mindful of is that 25% of those respondents were between the ages of 18 to 24, which are traditional college-aged students, right? So we need to really be careful of how we're taking care of our college students, how we're taking care of you all, and how you all are taking care of yourself. And another thing is that 18.6% of these respondents were Black and Brown. So we cannot say that suicidality doesn't happen in our communities. In fact, it very much so does. We've seen prior to the pandemic an increase of 300% in one particular age group as it related to suicidality within particularly Black folks. So again, this is something that we really need to look at, especially as we try to learn how to take care of ourselves during this pandemic. So how do we take care of ourselves, right? What is the first step? And to me, what I think the first step is having some sort of awareness, some sort of understanding of what it is to look for. Oftentimes we have a stigma in our community, and so therefore any kind of symptoms related to depression or anxiety, even if they are experienced, it's not necessarily encouraged, right, that we talk about this openly. However, I'd like to try to shake things up right now and get all of you to, maybe just mentally, commit to spreading awareness about depression, about anxiety, and have an open conversation about it with your friends, with your family, with your peers, because that's the true way for us to really fight through that stigma. So what are some of the signs of depression and or anxiety? Well, one of the first telltale signs are changes in mood, but not only that, changes in your energy level as well as your motivation. From time to time, it's normal for us to feel sad and low, and sometimes even, not as energetic. It's mid-semester time, and so that it's probably appropriate that you're feeling like this now. However, if this starts to persist for most of the day and persists for days at a time, it's concerning, and you should maybe take a little bit of a closer look at what might be going on around your life. You also might notice that you feel beyond exhausted. This sense of sort of fatigue really helps to feed the depression. One thing I like to talk about with my clients is that depression and anxiety is nothing that you should identify with. It is a monster that needs to be attacked. And how you attack it is by identifying some of these food items that feed the monster. So sadness is one of those things that will feed the depression. And I'll continue in that metaphor and that discussion in just a second. Another major sign of depression and anxiety is feeling a disconnect from your feelings. So when you feel a sense of hopelessness, a sense of helplessness, or a despair, you really may be experiencing depression and anxiety. And again, if you sort of have an overall disconnection from your feelings, it's like, meh, everything is just meh. This also could be a major sign of depression. In fact, in clinical terms, we call it apathy. You may not enjoy some of the things that you used to like to do. In fact, that's exactly what the depression tries to do, the depression monster. It tries to identify what it is that drives you and take away your interest from that. Sort of like an abusive partner, it tries to isolate you from your friends and your family. So social withdrawal can also come out of this as well. Another sign that you may be experiencing depression is if your food just starts to taste like bleh, or like plastic is what I like to say. Or if the world altogether just seems a little bit less colorful or less interesting. Chances are this is the depression monster trying to take over you. So again, be mindful of that and listen to what your body is telling you. This is very relevant as it relates to college students, but not just college students, everyone, since we all have daily activities and daily tasks that we need to complete. Difficulty focusing is a major sign of anxiety. Again, when it's minor, it's not a big deal. You might not, roll your mind over on making a decision about lunch or something like that. However, if you really have a difficult time in making a decision about lunch, and this is something that is very real, this could be a part of anxiety. In fact, again, we call this rumination, where your mind just rolls over from thought to thought to thought without any sort of provocation. This is anxiety trying to steal away your attention from the things that are important to you, so that it can grow itself, right? So the anxiety can grow itself. So you might feel distracted by awareness of how you might be perceived by others. And so another thing that could happen is having this sort of experience of inappropriate guilt. So if this is something that you're experiencing, again, listen as I provide some tips as to how you can cope with some of these things. And lastly, suicidal thoughts. Sometimes the depression can become so dark, so heavy, that it seems like I don't have anything else to offer here into this world. And you know what? If I wasn't here, I wouldn't be missed very much. Let me just say, this is a sign of severe depression. Now, I'm not saying that from time to time you might fantasize about, oh, I really just don't want to be here right now. What we're talking about here is something that is a bit more intrusive. It's something that is not fleeting, meaning that it sticks around, sticks and stays. It's a very dangerous situation to be in. So if you're ever feeling like this, please reach out to someone that you can trust. If you don't feel like you can reach out to someone that you can trust, well, then reach out to a professional, and hopefully you can put me as one of those professional resources for you, and I will be more than happy. Even if you reach out to me anonymously, I'll let you have my contact information. I will do all my best to try to help you as much as possible. So what are some of the things that you can do? How can we look after our mental health? Fine, we might know exactly what it is that we're experiencing, but fine, we want to get through it. How do I relieve myself of these experiences? What I'm going to be presenting might sound very, very simple, but is actually quite profound. Again, as human beings, we rely on organization, again, structure, and we need to also make meaning of what's going on in our lives. And some simple things that we can do to kind of regain that sort of balance or centeredness that could bring about wellness are these things that I'm going to mention. Now, again, this list is not exhaustive. There are a number of things that you can do. However, these coping strategies are something that you'll be able to start engaging in sort of straight away. So one thing is to maintain a healthy routine. Keeping up with your daily routines, such as going to bed and waking up at the same time every day, is really, really essential. Sleep is so important for us to, one, synthesize the things that we learn as college students, right? But two, for us to be refreshed and really be able to move forward in our day and really be present also with whoever it is that we're facing that day. Keeping up with personal hygiene is very, very important. Now, I know that many of us are working from home, attending school from home, and sometimes it's not required that we put on our camera, right? However, it's still going to be a very good exercise for you to wake up every morning and to brush your hair, to wake up every morning and to bathe your skin, to wake up every morning, and even if you do this, put on makeup, then put on makeup. As long as it's a part of your personal hygiene, you definitely want to keep that at the forefront. It's something very minor, but something that could really make all the difference as it relates to your wellness. Eating regular meals at regular times of the day is also a major way to remain well. Going back to the depression monster wants you to either overeat or undereat. They're also going to want you to eat nasty foods, fried foods, fatty foods, sugary foods, all the things that might bring you instant gratification at the time and chronic sort of hardship if you think about long-term effects of some of these foods. So it's really important that you eat cleanly and that you eat regularly. Exercise regularly is also really, really important. I like to promote the connection between dog and man or woman because our pets can oftentimes bring us that sort of daily routine. They will let us know when they need to go out and walk. They'll let us know when they need to eat, and that'll also help us to keep on our daily routine as well. Never mind all of the good feels that you get when you get to cuddle with your dog, which actually leads me to the next thing. Well, I'm actually skipping. Social contact is really, really important. And I'll go back to where I was just a second. And so, and I'll come back rather to the social contact. So since we're all home working and doing everything from home the way that we would not normally, just because of the response to the pandemic, we may also have very blurred lines about when work starts and when work ends. So another thing that I would recommend highly is that you allocate time for working and time for resting, and make sure that you stick to those things, and make sure that you take time for doing the things that you like to enjoy. Because again, the depression monster is going to want to take away your Zumba. It's going to want to take away your doing karate. It's going to want to take away your doing all of the fun things that you like to engage in, so that it can keep you sedentary and keep you still and keep you kind of immobile. This is major, major, major at a time like where we are now. It's very important that you minimize your news feeds. it's constant that we're going to be getting alerted by our news media channels. They are designed and informed by psychological thinking, by the way, to get your attention with these very alarming messages, with the colors that they're using, with the sounds that you're using. It's designed to gather your attention and really to keep it for a short period of time. The issue comes in when news starts to loop and loop and loop again. So what it only does is it keeps our mind in that sort of constant state of shock or constant state of panic, which can have detrimental effects on our body together. So again, there's always going to be a connection between the mind and the body. So one way that you can avoid that is, I'm not saying don't be informed, allow yourself to be informed, but by reputable sources and for no longer than 30 minutes to an hour. Once you hear a story once, you don't need to hear it again. Go ahead and move forward, but also be mindful of how much it is that you're taking in through video, through radio, through podcasts, through journals and things of that nature. Just be mindful of how much information it is that you're putting in your mind, because sometimes we're all on our autopilot and not necessarily really taking stock as to what we're feeding our mind. So be careful of that. I'm sure you all have heard about social contact. It's very, very important that we connect with our loved ones. Again, the depression is going to want to keep you away from your family, from your friends. So it's really, really important that you learn how to connect with them in some way, even if it's, yes, virtually. It's really, really important for you all to get that kind of support. So lastly, I just wanted to, again, emphasize that there is support right here at the university. We have both our campus counseling centers in Albert A. Sheen campus, as well as right here in St. Thomas, and the numbers are there. Again, we have very reliable, very confidential, professional counselors that work out of the center. If they're not able to help you, they'll be able to refer you. They're very versed into the community and will be able to network you to whoever it is that you need to go to. However, if that might feel like it's a little too close to home, just know that there's other agencies on island, in the territory rather, that again, this is not exhaustive, this list here, but these agencies are here to support you. So there's Island Therapy Solutions that are located both in St. Croix as well as in St. Thomas. There's Insight Psychological Services that's located right here in St. Thomas, and Mind Body Health Psychology is also located here in St. Thomas. Again, there's a number of other agencies that are excellent and that can be available to you. Again, it's all about your reaching out. If you do need that additional support, be mindful that all of these professionals that work at these agencies are going to be very confidential and are going to keep you at the center of the focus as it relates to supporting you. So I'm going to make myself available here as well. Here are my email addresses. You can reach me at the university, or you can reach me at my private practice email address. I'm also going to pass along my cell phone, my mobile contact. If you all ever have a question that you just want to send, you can shoot me a text. My number is 340-626-8106. I'll make myself available for questions. If you might feel like some of what you were saying today is kind of hitting home. Perhaps I could use a little bit of support. I'll be more than happy to provide you suggestions as to where to go from here. So I'm aware of the time. I know that it's a minute past my allotted time. So I just want to thank you all for coming to this presentation, and I hope that you were able to glean some insight about what an anxiety and depression looks like and how we can really handle it and contain it. So thank you all.